Okay, everyone, we're going to get started. I'm Kathy Rowe. I'm the new Executive Director of New Jersey Advocates for Aging Well. Many of you know us as New Jersey Foundation for Aging. And I'm going to make a confession that this is the first time I've been the host of a webinar. So if someone would put in the Q&A, just confirm that you are able to hear and see the screens. That would be a big help. The rest of us are panelists and have different access to it. So just to make sure everything is set up well. All right, thank you very much. We have a great audience today. Thank you for letting me know. So we're going to use that Q&A function today as we go through our presentation from Bright Side Manor. We're going to talk about the PALS and ALPs programs and specifically what they're doing in Bergen County. I want to thank Parker for bringing this to us today, for hosting this webinar. It's the third in a series, and for being a great community partner with us. One of the primary goals of New Jersey Advocates for Aging Well is to help people age in place, age well, and age in the communities that they love. So we feel that these are great examples of how people can do that, how they can stay in their homes or in independent living, how to meet the needs they're going to encounter as they age. And we all know that needs are constantly changing. But I think we have a great panel today, and I'm going to get started with Margaret Borunjian from Parker.
Good afternoon, everyone. Thank you. Good afternoon. So I have the pleasure of being the Marketing and Communications Director at Parker. I've been with the organization for almost 13 years. So we have been growing and changing. And so I'd like to just show you, for those of you who are not familiar with Parker, I'd like to just take you to that. So we have been around since 1907. One of the, we're very proud of our history and legacy. And we have started with a small nursing home in the heart of New Brunswick with 16 residents or 16 patients that they call. But now we have been really growing and expanding. And as we all know, we're expecting to have a number of older Americans is expecting to grow in the next couple of decades. And we believe that we have a commitment to change the way that people are aging in America. Next. So we have rebranded about 3 years ago, and I'm very proud of our vision. We make aging part of life, because regardless if our people, our elders are living within our communities and our homes, or they're aging at home and in the community, we do believe that it's something that as healthcare professionals, we really want to make that experience manageable, relatable, and enriching. And we do believe that we're doing this for all of society, not just here in New Jersey. Next. So one of the things I'd like to share with you is our legacy started in 1907 with a absolutely visionary Henrietta Parker Stromberg. And she has fulfilled the dying wishes of her beloved husband, Francis, who she was caring for the last 7 years of his life. He was bedbound. And so in his memory, she established back in 1907, right after St. Peter's Hospital was opened in the heart of New Brunswick, she established Francis E. Parker Memorial Home. And she really felt that people should receive affordable quality nursing home in a home-like setting. So it really is a home-like setting that we are really continuing to establish. And the other thing that we're very proud of is the biggest problem, just as we're experiencing right now, is there was a lack of quality nursing people. So she established her own nursing school right there with the relationship and an alliance of the hospital. So that these ladies were getting education. It was a 2-year program, very, very rich. And so, of course, they were difficult years. We have always been not-for-profit, charitable organization, and actually it was the donations from the community of New Brunswick that really propelled her. Next. Right now, at this point, we have still the nursing home. That little nursing home now has 50 residents. So it grew from 16, and this continues to be in New Brunswick. But now we have 4 nursing homes. We have also assisted living, just one assisted living in Highland Park. We specialize in memory care, post-acute rehab. But we also have on the left side is our home and community services that we're very proud of. Over the last 13 years, we really expanded adult day centers, health and wellness center, rehab at home, and also Parker Navigator, which is a care management for people that are aging at home. Next. So I just wanted to let you know, so of course, person-directed, person-centered care is at the heart of our quality care. And our legacy home still continues to be on Landing Lane in New Brunswick. And it's a charming home-like setting, very, very embracing, lovely, lovely old home. Parker at River Road, we started and built it in 1982. And it has a small home model of memory care in there. And right next to it is our assisted living in Highland Park. Parker at Somerset is one that we actually acquired from the St. Peter's Hospital system. And it has post-acute rehabilitation, both Medicaid and Medicare, and also high quality nursing home. We are very proud of having a construction, which started about 3 years ago and continued through COVID. And we're already expecting this fall to have it open. And again, this is going to be a small home model person-centered care home. Parker at Monroe, again, new building, built 7 years ago now, and small home model, and it's in Monroe Township. Next. Assisted living is something that we're going to learn quite a bit about it. And so it is a very small 60 apartments only. And we're very proud of all of our amenities. So we have 2 dining rooms with very, very restaurant style dining room, bistro, solarium, and a heated indoor pool for our residents with a jacuzzi. Chapel, we have a non-denominational chapel that is also gathering for the entire River Road campus. Studio, 1 bedroom, and also 4 2-bedroom suites that are quite large, up to 1,250 square foot. Dining services is something that we are extremely, something we really, really strive to provide. A restaurant style full menu and lots of alternative choices because we know how important dining experience is for our residents. We have on-site 24/7 skilled nursing staff and of course very, very dedicated staff. Our medical director has been with us with Parker Services for over 30 years and is here. All of our medical directors are gerontologists. Next. The post-acute is a 5-star community. And of course, this is the one that is getting built. So we are going to have tremendous private suites with private bathrooms. And we are very, very big on infection control. The new building is actually built with a lot of infection control technology. And we specialize with stroke, cardiac, pulmonary, and orthopedic rehab. Next. And very important, we have 2 adult day centers. One is in Highland Park, and it is both medical and social model. Social model is typically half a day with specialized memory, and another one in Monroe Township. And in the new building in Somerset, next year, it's not going to happen this fall, but early of 2020 is going to be a 3rd adult day center. And our new service, the Senior Care Coordination, is a park navigator. And this has been a tremendous resource for people during the last year with the COVID isolation. So we actually work with seniors who are having challenges, transitions, and perhaps their loved ones are not close by. Also the health and wellness service. So since we have this pavilion with indoor swimming pool and gym, personal training, we have opened that about 10 years ago, actually, to the community. So we offer a monthly service. And before COVID started, we had over 280 people enrolled in the program. We also provide rehabilitation, rehab services here, physical, speech, occupational, and rehab at home has, again, as you would expect, has grown tremendously because so many people are really aging at home, and they really cannot get around. So all of those, and we also provide adult day services at the senior housing buildings in the area. Next, I think that's it. Thank you very much. And I'm looking forward to our speakers this afternoon.
Thank you, Margaret. So if everyone wants to take a moment, if you'd like to get in touch with Margaret, or if you have questions for her, you can put them in the Q&A. If we don't answer them today, I will forward them to Margaret. Right now, I'm going to stop sharing and turn it over to the Bright Side Manor staff. So we have with us today Elizabeth Davis, who's the founder and executive director of Geriatric Services, Inc. Their facilities and programs include Bright Side Manor, the Brookdale, PALS, and age-friendly Teaneck. Elizabeth is a licensed clinical social worker and a certified assisted living administrator. With her is EJ Vizzi, who is the assistant administrator and social worker of the PALS program with the Bright Side family. EJ is a licensed social worker, a certified assisted living administrator, and a certified dementia practitioner. And Julie McGaffin, who is a nurse administrator of the PALS program. She has 41 years of nursing experience, is a certified assisted living administrator, and a certified nurse in palliative care. So we have a highly qualified and experienced team here with us today. Thank you very much. Okay, EJ, we see your screen. You can go ahead.
Okay. Yeah, I think I'm going to get started. And again, I'm Elizabeth Davis, and I'm the executive director of the Bright Side family, which is actually a group of nonprofits. Geriatric Services is the first, and that's the original, and that was founded in 1990. And collectively, our organizations provide affordable housing, assisted living, and other support services for older adults. Our work began at Bright Side Manor, a building that has served as a community residence in Teaneck since around 1915. And our goal when we took it over in 1990 was to update and upgrade the facility and create an affordable, supportive housing resource for older adults that would provide good care in a warm and home-like environment. At that time, there was no such thing as assisted living And so there were boarding homes and residential healthcare facilities of varying qualities, and Bright Side was a residential healthcare facility. Several years later, New Jersey did adopt regulations that licensed assisted living, and we began work to bring this very old facility up to those new standards. So after major construction, we, in 2003, we became an assisted living provider, and for a number of years, Bright Side Manor was our only focus. But over time, we realized that the need for affordable housing and affordable assisted living was growing, and we decided that it was important for us to find ways to address those needs. So in 2014, we launched PALS, which stands for Portable Assisted Living Services. It's a licensed assisted living program, which is what we're going to be talking about today. And we launched that in Westwood, New Jersey. And that same year, we started construction on the Brookdale, which is a 62-unit subsidized senior apartment building, which has been very creatively designed to support aging in place. In 2015, we launched Age-Friendly TNEC, which is an age-friendly community initiative. It's been funded by the Henry and Marilyn Taub Foundation, and it's one of many initiatives in New Jersey and throughout the world that are focused on making communities better places to grow up and grow old in. And then in 2019, we brought PALS into one of two senior buildings at Garfield Housing Authority, so that PALS was then in two sites. And today we're working on bringing PALS into the second of those two senior buildings, so that we'll be in 3 locations. And we'll soon be breaking ground on the construction of an 8,000 square foot addition on Bright Side. It'll give us much needed additional space. And then later this year, we'll be breaking ground on construction of another 40 units of affordable senior housing, also in TNEC. Next, please. So what is an assisted living program? New Jersey is unique in that it licenses assisted living programs, and assisted living programs are one of 3 types of assisted living licenses regulated by the New Jersey Department of Health. Assisted living residences are one of the 3, and those are typically new facilities with apartment style units. And then the third is comprehensive personal care homes, and that's what Bright Side Manor is. These are usually older facilities that convert to assisted living and typically offer either private or semi-private rooms, but are not required to have apartment style units. So assisted living programs, again, it's a unique model to New Jersey, and they provide services that support the needs of low-income residents in subsidized senior housing who are no longer independent, but can't afford traditional assisted living communities, which in Bergen County, where we are, can run anywhere from $6,000 to $14,000 a month, and want to avoid being pushed prematurely into nursing facilities. And importantly, they really just want to stay in their own homes and communities where they have friends, family, and connections. Assisted living programs share the philosophy of assisted living, which is promoting dignity, independence, privacy, choice, and individuality. Next. Oh, I'm sorry, but they also support housing providers because housing providers are often very skilled at managing buildings, but not necessarily the needs of increasingly frail residents with complex care needs. Okay, next. Sorry about that. So you're going to be hearing from EJ and Julie more details about what the services that an ALP provides. But basically, it's the services that you get in any assisted living facility. It's oversight or administration of medication, it's assistance with personal care and overall wellness care, laundry and light housekeeping, meal preparation, social work services, and help in accessing any other services that the resident might need to remain safe and comfortable and healthy. Staff is on site 24 hours per day. It can be either building security staff or ALP program staff. With PALS, we have on-site nursing and aid on staff at least 12 hours per day, and our nurse is on call 24 hours per day. And ALPs all vary a little bit. It depends on the census, how many residents you have and what their care needs are. So there could be nursing and aides on site 24 hours a day. Okay, next slide, please. So how did we get started with an ALP? Because Bright Side is Bergen County's only truly affordable assisted living provider and the only one that routinely accepts Medicaid, we found ourselves receiving more and more calls from subsidized senior housing providers who were needing help either placing or securing services for tenants who were no longer independent. Again, most assisted living communities are out of reach of low-income older adults. And then as we began planning to build our own senior housing, we did so with a sensitivity and awareness that there are a lot of responsibilities that go along with operating senior housing, and that we felt the need to be prepared and to be ready to meet the needs of our tenants as their physical and cognitive functioning changes. Then, at that time, there was Hurricane Sandy, and we were getting urgent, calls from housing providers asking for help with getting food to their buildings and concerns about their tenants who were living in apartments where there was no power. And so, again, I realized that operating senior housing comes with a lot of responsibilities. So we made a commitment to ourselves that when we built and were operating our subsidized senior building, that we would secure our license to operate an ALP and be able to offer that to our residents. And then I thought, well, why not reach out to some existing housing providers and see if this is a service that our organization could offer in the community. And we were welcomed with open arms by Westwood House in 2015. This is a 182 unit senior apartment building that opened in 1980. And when we began providing services there, they had tenants who had been there since the opening. So they had a large number of tenants who were well into their 90s and even hundreds. And then again, we expanded into Garfield Housing Authority in 2019. We have served a total of 82 residents and currently have 31 actively enrolled. Next, please. So ALPs are a little bit of a well-kept secret, but there's actually 14 providers in New Jersey, most of which are in the southern counties. PALS is the only ALP program or ALP in Bergen County, although that's not to say other providers couldn't open, as many providers as would like to can operate in a given county. An ALP license does allow a provider to serve any subsidized senior building in a county and one contiguous county, with an option to seek approval to expand beyond that region into other counties and even statewide. And there is a process that you follow as you go into a new building. Next slide, please. So again, you'll be hearing more details about what it's like to operate an ALP and some of the challenges that ALP providers encounter. But as I said, there isn't still a lot of awareness around the ALP model, and ALP providers are not, have not historically been particularly well connected or well represented. And so with support from the Henry and Marilyn Taub Foundation, we began working a number of years ago with Capital Impact Partners, which is a community development investment institution. And they have been coordinating an effort to bring ALP providers together in a coalition that is focused on building awareness of the model, influence changes to the regulations to truly differentiate between the ALP model and facility-based models, to campaign for higher reimbursement rates, to promote collaboration and sharing of information and strategies among providers, and importantly, to document the program's impact both on on the residents we serve, the housing providers we work with, and on cost. And so we've been working with Rutgers University School of Social Work on a research project that is going to be collecting data to again document the ways in which our program impacts the people that we serve. So we hope through these activities that we're going to make the ALP model stronger, promote its growth and expansion so that it can be a strong resource to serve the growing numbers of older adults who are aging in place within subsidized senior housing. And so with that, I'll turn the virtual mic over to EJ.
Thanks, Elizabeth. And thank you, Margaret, with the Parker House, for allowing us to present about ALPs, this well-kept secret, as Elizabeth was talking about earlier. And so I'm going to help talk about actually getting people signed on and walking through some of the eligibilities of getting onto an ALP program. And so the main thing that we really focus on is this vision for impact. How can we impact our individuals' well-being, the loved ones that our families inquire about, or the individuals themselves. And so as many who do work with older adults, they recognize that in order to maintain the best possible health levels, they usually like to keep some level of independence, social connections, having the choices and options, and really helping to promote that. And so that falls in line with assisted living and the mantras that we believe in with choice, dignity, integrity, and privacy. But the main thing I think that we have come across with really helping to create this impact is the focus on preventative care rather than reactive care, because recognizing that your loved one needs care may be more helpful to their overall well-being rather than waiting for a crisis moment to hit, then reacting and figuring out how are we going to take care of them. So kind of recognizing it before it hits that crisis moment, would be most ideal. And I think that's something that the World Health Organization has also been pushing for most of my life, I think. And so some of the eligibility requirements to get onto an ALP is, first of all, the first thing is anyone who resides in this subsidized senior housing building that has an ALP provider in-house and wants care is eligible for receiving ALP services. They would continue to stay in their own apartments. They would continue to pay rent to their management organization, utilities to PSE&G or an energy provider. They would still pay their own cable, telephone. So they are staying in their own apartment, but they have recognized that they maybe have grown dependent on some personal care needs, or that they maybe need a little bit of help getting dressed in the morning. And so that's kind of the preventative care that I was talking about earlier. And so many of the residents, so if an older adult recognizes that they might need some care or they'd like to apply for the ALP in their building, they can privately pay at an agreed upon cost. Some ALPs charge a flat rate that are comparable to the Medicaid reimbursement. Some do a sliding fee scale based off of your income, and some ALPs charge depending on your care needs. And so again, depends on the provider and the county and the state that you're in for what the costs might be. However, since most of the residents are living in subsidized housing, which are typically HUD housing, they are they do have low to moderate income, and they opt to apply for Medicaid to pay for these ALP services. And so I'll take a couple minutes to talk about what it takes to apply for MLTSS, which is Managed Long-Term Services and Support. And that's the type of Medicaid that would help pay for assisted living services. And so there are three components for eligibility with Medicaid MLTSS. The first is age, so you do have to be ages 21 and older. Second is financial. And so you do have to have your assets and resources below $2,000 at this time, With the ALP Coalition, we are advocating for that asset limit to be higher, recognizing and being sensitive to the idea that these residents, are living in the community and they are still paying rent and they are still paying for a lot of their own personal care needs. And so we're hoping to advocate for a higher assets limit. But as of now, that's where the numbers are. And then for income, traditionally, if you're below $2,382, you can easily be eligible for Medicaid MLTSS. But I do want to note that there technically is not an income limit to apply for this, because if you are above the 2382 limit, you're eligible to apply for a qualified income trust, which is a QIT or Miller trust. And that will help any income that is above the 2382 limit will go into a trust, and it does not disqualify you from applying for a Medicaid MLTSS. So I just want to reiterate that there technically is not an income limit. And then you also need to qualify clinically. And so that would be hands-on assistance with at least 3 activities of daily living, or ADLs, or you need to show cognitive deficits where you require either supervision or assistance with at least 3 of those ADLs. And I think Julie will probably get into that a little bit more in a couple minutes. And so to apply for Medicaid MLTSS, you would want to contact your local AAA or your area agencies on aging or your Aging and Disabilities Resource Center. Most times it is your county board of social services. And so you would reach out to them and submit this application. There are also options to apply online with your family members, or you can also submit an application with a care management organization or a CMO. In Bergen County, we are fortunate to have Bergen Family Center, Jewish Family and Children's Services, and Catholic Charities to help us as a CMO in the county. But there are many options out there to help people apply for the Medicaid application. And it is lengthy and it is complicated, and we'll get into why that can be a barrier for some people who just become a little bit overwhelmed with the paperwork that is needed. But in New Jersey, Medicaid MLTSS does use New Jersey Family Care to manage all the care organizations for all the health services. And so I might call them MCOs, HMOs, or health plans. They're all the same. They're all the insurance companies that that MLTSS needs to connect you to. I think prior to 2012, when someone was eligible for Medicaid, it was a state program and you were able to simply get reimbursement through there, or the providers were, my apologies. But because New Jersey became a managed care state, you do need to get assigned to a healthcare insurance company. And so we have the options of Aetna, Amerigroup, Horizon, United Healthcare, or WellCare. And again, when you do submit your application, you have these options and we can walk you through them. They all can provide the same services to you. And so in helping people apply for MLTSS, I and my team, we have noticed 2 camps of older adults who are interested. And in one of the towns that we work with, or cities rather, the per capita income is just above $30,000. And those residents tend to be lifelong seniors who have lived in poverty with limited resources. And the poverty rate in that city actually is 16% as of the 2019 Census Bureau. And then in the other city that we work with, the income per capita is just above 54,000, which is a stark difference to the 30K. And those seniors find themselves in low income secondary to retirement, or maybe they had lived longer than they had expected to. They were saving for retirement until maybe 60 and 70, but now they're living to their 90s. And that's great. You know, they're living healthier lives. They have longer lives to be with their families, but now they're finding themselves financially strapped for cash. So they either need to spend down the savings that they did have, or they've already found themselves in those positions. Of course, I don't want to make any assumptions to where people are located. This is a snapshot, and it's not exclusionary to any individuals in the communities. And New Jersey is so diverse, so you'll find all types of individuals with different types of financial pictures, regardless of city boundaries. So I just wanted to make that caveat. So when you're actually enrolled into MLTSS, so let's say you did go through the application process and you have MLTSS, you've been assigned to an insurance company like Horizon or Aetna. And I am going through this quickly, so if anyone wants to ask questions later on, please feel free. But once you have the insurance company enrollment, you are allowed to get authorization for certain care needs. And so traditionally, we like to make sure and advocate that at least those we get on the PALS program have what I call my triple threat of assisted living services, which is PALS, home delivered meals. So that would be 14 frozen meals brought to your refrigerator or freezer, similar to maybe like Swanson's or Hungry Man meals, and the personal emergency response systems, life alert button. So help, I've fallen and I can't get up. So you can get those type of buttons for free under your insurance plan if you have MLTSS. And we try to make sure and advocate that our residents sign up for these free programs. You of course get care management, you get assigned a case manager from your insurance company, and you have access to respite care if your caregivers need additional time off, or if maybe the assisted living program, say you had, maybe you need more care than what is provided for a short period of time, you can get respite care, mental health and addiction services. MLTSS outside of ALPs also can pay for skilled nursing home care, adult daycare programs, and assisted living facilities. And so again, when they are enrolled into an insurance plan, we at PALS or anyone with an ALP provider, we really advocate and help to maximize the benefits that are afforded to them. As one of the social workers with PALS, I have a close relationship with many of the insurance company case managers, calling them regularly to just make sure like, hey, this authorization is expiring. Can we make sure they don't lose it, or before it's lost, But then also with my administrator or assistant administrator hat, I'm calling the case managers from the insurance companies to alert them and update them about any major falls or any hospital visits, because they do need to report those on their end as well. So of course I'm biased, but I do think it's a great program outside of my role with PALS and Bright Side Family. I think everyone should sign up for it. But there are some barriers to which people feel either whether emotionally or financially or clinically ineligible to sign up. And so one of the major things that we have come across is the resident denial around the need for assistance. Sometimes we speak with an older adult, and instead of recognizing that they themselves need it, they say, oh, that sounds nice for my neighbor. Maybe I'll go get Mary to sign up, when really we were speaking with them about their care needs. And so sometimes that can happen. Because we did talk about finances, that can be a sticky subject for some older adults and some individuals overall. So the reluctance to spend down their resources to qualify for MLTSS, or to use the resources that they have spent their entire lives to make sure that they're taken care of in their older years and their aging years, they don't want to use that money to pay for their own healthcare needs. And so sometimes that can be a process to at least, speak with them about. It is a sticky subject, and we understand and we recognize that. I touched upon how the Medicaid application, should they go down that route rather than private pay, can be very lengthy and confusing. There's a lot of pages, and it's overwhelming, it's intimidating. We hope to try to ease that as much as possible, but sometimes people can be deterred and the process takes a little bit longer than it really should. The concern for assisted living programs and ALPs is that we are sending them to a home, or we're sending them outside of their apartment, when in reality, the focus we're trying to do is keeping them as independent as possible so they can stay in their apartment. This is the step before they truly need 24-hour care needs. And so recognizing that you need help maybe a couple hours a day, or not even at like portion a couple hours a day, but just in the most important days or times of your day. For example, if you need someone to help you with breakfast in the morning and to shower and get ready, get dressed, but then you don't need them until your afternoon medications. And so again, Julie will get into that, but there certainly is a discrepancy between transferring to facilities and staying in your apartment sometimes. And then of course, the biggest barrier is the lack of awareness of ALPs. Elizabeth had touched upon how there are 14 providers in the state. The New Jersey Department of Health had created this license in the 1990s. However, there are only 14 providers since that time. And so for those who do, like Bright Side Family, become ALP providers, there can be some challenges on our end, but we are advocating for those as well through our coalition and through speaking with state representatives. And so the reimbursement rate is low, and sometimes that isn't adjusted according to the care levels. We always have to educate almost anyone, because ALPs is a well-kept secret. So when we ask for the authorizations from case managers and it's not someone we've worked with in the past, they ask, oh, okay, they'll be transferring to a facility. No, they're not transferring. We just need the authorization for them to stay here and continue getting nursing care. Sometimes just for provider purposes, we don't force people to move into certain apartments just because they are on an ALP. They get to stay in the apartments that they are, and so they can be far apart from each other. So if someone is helping one person on the 8th floor and they need to go to someone down on the 2nd floor, the elevators may take a while. So I just wanted to call that out. And building management can be concerned about whether their buildings are becoming a nursing home if the ratio goes too high. Oftentimes, this is an unfounded concern, but we recognize that it is a very real concern. But once they realize that they're not becoming a healthcare provider, they're continuing to be a housing provider, and we are the healthcare workers, then it does become a very friendly and collegial relationship. And then, of course, if ALP providers do want to go into a new building, there needs to be enough residents who are interested to enroll, or else there would not be an economy of scale. We wouldn't be able to actually continue getting the funding to provide the help that we would need. And so after all of that, if you chose to enroll into PALS or other ALPs through private pay or through Medicaid, my favorite is, of course, actually getting them enrolled into the PALS program. And so we would be able to help them with coordinating their medical care. They can continue seeing their doctors out in the community, or we can connect them to the doctor who comes on site into the building. We do have recreational activities, but that is open to almost everyone in the building. It's not always specific to the ALP provider or ALP residents. And just constant coordination and advocacy with the building management, of course, because sometimes calling your landlord or your management office is not the easiest thing to do. And so once they are on PALS, I'll let Julie talk about all the beautiful, amazing things they can get.
Julie, just let me ask one question before you get started. We have a question about costs, and I don't know if you could easily answer that, EJ, or if you have to look it up. But if someone were paying private pay, do you have a ballpark or a range for what those costs would be?
Do you want to answer, Julie, or do you want me to?
Yeah, I can speak to that. So
okay, thank you.
So very good question, right? We charge what our reimbursement is, which is basically Medicaid funded. MLTSS is $59 to $60 a day, which is $1,800 a month. So imagine $60 a day, getting 12 hours of services, med management, home health aid care, the wide range of services that we're able to offer, plus oversight. You can't touch that for $60 a day. I do, we have private pay people who are spending down in order to qualify for MLTSS. And we do recognize that some people don't need all of our services. So we do offer what we call PALS Light. And that's, it's not a la carte, but it's actually half that. So it's $30 a day. And these are the people who still need oversight, but they need some supervision. They don't need the full, you know, program, but they do need help. And this is what keeps them safe and in their apartment. So does that answer the question?
But I would just add, Julie, that if a person qualifies for MLTSS, there's no out-of-pocket cost to them,
Yes.
right?
Yeah.
So we bill Medicaid, and there's no cost to the resident on MLTSS.
Thank you.
Absolutely.
And if anybody else has questions, continue to put them in the Q&A and we will get to the rest of them when Julie's done her presentation. Thank you.
Okay, so we've done a lot of talking. What does this look like? We come into a building and we recognize that some of our people are needing assistance, but everybody's different. So we do a personalized assessment. Everyone ages differently. Some people have greater needs than others. Some people need help with breakfast, lunch, and dinner, dressing, bathing, everything. Other people just need a little bit of oversight, med reminders. So what this actually looks like, if you can imagine like a sunrise assisted living without bricks and mortar. We are, you know, we would come in the morning and I'm an RN, we have LPNs and we have home health aides. So we'll come in to start in the morning at 8 o'clock and our aides will go to one apartment and say, make breakfast. Then go to another apartment and do a shower. Go to the third apartment and help with housekeeping or laundry. Then go back to the first apartment and clean up the dishes. The nurses will start also differently according to the care needs of each of the residents. We do give medications to probably about half of our people. The other half don't need it, but we do check in on them every day. We do vital signs and give medications for the people who do get their medications. In addition to that, we the oversight, the care management involved is that if somebody has changes in vital signs or a change of condition, that we're on the phone calling the doctors. We're able to order PT, OT, speech therapy. We have podiatrists, eye doctors, ear doctors. We have a visiting physician who comes in that we're in regular contact with. So this sort of care management that is really like hands-on care management. We're able to see people decline before family members can, and certainly before the doctor can, because we're here every day. Yes, we have served 82 residents and we have 31 right now actively enrolled. The sky's the limit as far as how many people we can take on. We will staff according to our population, our census. We are here 7 days a week, 365 days a year. Something that really kind of defined our program for me as a healthcare professional and also as a member of the PALS team is in this pandemic when we found that everything closed up and services went away and the management of the building is gone and a lot of the social services were gone. We were still here 7 days a week. And we became a very important resource to the community because there was no one else. So we became an outreach point for both buildings. And it really just kind of, it for me defined, what it is to be in healthcare. That is very much a public health endeavor. We run our buildings from 8 a.m. to 8 p.m. I'm on call 24/7. I share that call with another RN. We find that a lot of the healthcare decline that we see never reaches a crisis point because we're there to intervene before it becomes a crisis. When EJ was talking earlier about people, the reluctance to get onto MLTSS, to spend down, they're holding on to that 5,000 or 10,000 they want to give to their children, when their children don't want the money, they just want their mother or their loved one to have good care. But there's that reluctance, particularly with this generation. Next, EJ. So we help with every aspect of the care of our residents. We do a resident assessment on admission. We don't want to enable anybody to be less active than they would be, but we want them to be safe. So we individualize the care plan, and then we have ongoing assessments as the person ages in place. Some people need help with personal care, but if they can do some of their personal care, we want them to do that. The last thing we want to do is to keep people, is to have people age because they're not active in their own care. So we're ongoing health monitoring, nursing services, as I mentioned. We communicate with the healthcare providers outside of the building. We make doctor's appointments, x-rays, on and on with preventative medicine. Social services is very active in the care of our residents. They are instrumental in helping our folks get onto MLTSS. As EJ mentioned earlier, the process is daunting outside of a pandemic, and on top of in a pandemic, it's just been very, very difficult. We do have housekeeping and light laundry. Recreation services, we have music programs. Especially in this pandemic, a lot of our folks were in lockdown, and we were seeing huge decline, physical, mental decline because of the isolation. So we stepped up our visitation, our music programs, just to answer those needs. We do help with transportation and communicate regularly with families to have foods delivered. Next, EJ. So this is the coordination of care that we're so honored to be able to be a part of. We have psychiatrists, psychologists, podiatrists, PT, OT, speech, x-rays, phlebotomist, any sort of the services that we're able to bring in so that our people don't have to go out. It's the best care is the care that comes to you. And if you're not feeling well, the last thing you want to do is leave your apartment. So the idea is to keep our people as healthy as possible, living in their apartments as long as possible, and having the maximum quality of life. Next. Okay, and this is what we see. Enrollment often comes at a time of crisis. I have people who have been in our pipeline, so to speak, for years, and they keep putting off, going through the Medicaid process, until they reach a crisis, and then they need help, or maybe they're beyond our help and they end up going into a nursing home. Whereas if they'd come to us sooner, we would have been able to keep those accidents, those broken hips, those crises from happening. A lot of our folks are afraid. They know they're aging, and they see that they have this irrational fear that if they can't take a shower by themselves safely, that maybe the building will kick them out. Whereas the reality is the building managers brought us in so that we could keep them in their apartments. That's what everybody wants. BJ spoke about the two demographics. We have such a wide range here in New Jersey, and particularly in Bergen County here. We have one building where it's a majority of people who are white collar workers who have outlived their money. They tend to be older and healthy. And then we have another demographic where a lot of, say, the blue collar workers who are sicker and younger, actually, and who have a myriad of life experiences that makes it very difficult for them to manage their care now. So we're here to be able to piece together a whole range of public health needs. We do have a lot of dementia as our folks are aging, and with that we're able to they're able to qualify for MLTSS because they need supervision in their ADLs. Next. We do get referrals from the building management. We take their problem children and are able to keep them safe and in their apartments. And when that's no longer possible, we're very active in their placement. And it's always a family, a group decision. But because we're in communication with so many different other entities out there, we have the resources with our social workers and the community that we're able to bring all that information to make an informed decision, in the best interest of our residents. We have a lot of complex diseases. We've got dialysis, we've got mental health issues, of course, diabetes, strokes, falls. Medications, for a lot of our folks, and particularly in this day and age, it's overwhelming for the residents to be able to even manage all the pills that they're being given. And what we do see is a lot of our people see so many specialists, and the specialists don't talk to each other. So who's driving the boat? It's so to have that management so that we can make sure the doctors are talking to each other, that maybe one medication is for treating one disease is not working well for the other parts of the body. We do provide that communication among the caregivers so that there is a unified idea, a plan, a care plan. And we're able to make sure that our folks are eating well. And again, with the food insecurity in this pandemic, that was a huge need. We went to the food bank and just had 25 boxes of food because I was afraid that we weren't going to have food for our folks when everything else was just drying up. Next. Okay, so the face of PALS. Here we've got some poster children. Jeff is one of our favorites. He is on dialysis. He came to us, he'd had a hard life and has just blossomed under our care. Absolutely. Yeah, I think he had just a couple teeth in his mouth and his glasses were broken. And now with that beautiful smile and crystal clear glasses, he's enjoying a quality of life that I don't think he's had for most of his life. We were able to get a bunch of clothing donations, and when he got a pair of pajamas, he said he hadn't had pajamas since he was 7 years old. Josie. When I first met Josie, she was on the 9th floor of a sweltering apartment with no air conditioning on. Her pills were strewn all over the table, and she was totally overwhelmed by her care. Since then, she had eye surgery so she can see clearly. She's holding up her COVID-19 vaccination card, and she's just it's so clear to see that she's thriving in her later years. It's probably the most rewarding job I've ever had. Next. I guess actually EJ and Elizabeth spoke about the research project. You're probably better qualified to talk about that than I am, but it certainly has been validating the work that we're doing. Without a doubt, working with the ALP Coalition has shown many of us that there are many different interpretations of this program, and we're able to work it for the community that we're serving, and that has that's really been valuable for all of us, I think. EJ or Elizabeth, do you want to add something to this?
Sure. So yeah, we had opened up PALS in 2015, and recognizing that there weren't a lot of ALP providers, how can we really help put the word out there? So fortunately, the Rutgers School of Social Work and Dr. Emily Greenfield had interviewed some PALS members and our staff and residents to really put a picture, a snapshot on what the experiences of being on an ALP in New Jersey can look like. And so that research paper is available for viewing. Right now, you can find it either on the Rutgers School of Social Work website or on the Henry Mellon Taub Foundation aging or resources page. We have been working with Capital Impact Partners and the ALP Provider Coalition. We had been working with Capital Impact Partners prior to the official coalition start date, actually, to really help study the business models of ALP to ensure that it was, a sound model and that we'd be able to grow this. There needs to be an answer, honestly, why many people have not wanted to become a provider for it. And so we do think that it is feasible, it is doable. We clearly are doing it. And hopefully we can really help put the word out there. And again, Elizabeth touched on this one, that there currently is research data collection happening again by the Rutgers School of Social Work right now. They had chosen PALS and 3 other ALP providers in the state of New Jersey to do a bigger follow-up really on what aging in place with an ALP can look like. And so they're interviewing 40 residents in each of the ALPs, 20 who are on the ALP program, 20 who are not on it, but maybe have shown an interest in it, but haven't quite decided to yet. Or maybe they already are receiving care, piecing through some help from their family members, or they have a home health aide, or they had needed the care and recovered and don't need an ALP. And so they're truly trying to put together this research paper so that we can really help promote the value of ALPs in the state of New Jersey. I believe that due to the pandemic, some of the research had been stalled. Initially, it was going to be in-person interviews where they can really take an expose of the residents, and then it had to be turned into phone interviews. But through connections with the social workers or the ALP staff, we were able to help out the Rutgers School of Social Work. And on that note, thank you for joining us on this. We wholeheartedly welcome questions, inquiries, anything that you'd like to ask us.
Thank you. So we do have some questions. I'm going to, not that any of them are easy questions, but I'm going to go for ones I think you could answer maybe more quickly. You did talk about the importance of reaching someone offering services early on to help them stay in their home longer before their needs increase, and to keep them out of nursing homes. But we have a question about, have you had to decline people because the need was just too much for PALS to handle? And how do you handle that situation?
Delicately. We have, of course, I understand the natural tendency to want to wait, as long as possible for reaching out for help. But sometimes it does happen that people decline so quickly that we're not a safe alternative for them. So we try to help them get placement. There's a lot of family counseling that goes into this. A lot of, we're a society of denial. We're never going to get old. We're never going to die. And then, and if your mother has lived 99 years, well, why wouldn't you think she's going to live forever? She's lived 99 years. So it's a lot of counseling, and that's where our social work staff really step in, and a lot of nursing intervention and disease progression. That this is life, and this is life getting older, and we try to normalize this whole aging process, because it's we shouldn't be such a age, a youth only a society. It really does a huge disservice to the wonderful wealth of people that we serve.
And that response leads really well into this next question. Do the ALPS or PALS program, do you provide advanced care planning services for residents, considering that they do have needs and may have deteriorating health over time? Is that something that you have done in the past, or interested in building up that skill set?
Do you mind if I go ahead and it's part of the admission process.
Okay.
Part of the admission process is discharge planning, whatever form that takes. And so, yes, so we do a huge disservice if we don't talk about those things, so that when the time comes, it's not a crisis. It's, a well thought out decision. And so, yes, definitely the providers and the support staff, this is something that we actually address on admission.
Yeah, so we do start the conversation on admission. Sometimes we get people who decline and defer, and they don't want to talk about it yet because, like Julie said, they're never going to pass. But we do aim to try to update that at least annually and revisit the conversation, because it is worth, rediscussing and bringing up again. And sometimes family structures do change in a year, and it needs to be updated if they did have something. We do try to refer, if it's a complicated, financial picture, we refer out to elder care attorneys. They really are that's their bread and butter. But we do as much as we can and work closely with their PCP as well as they provide other APC services.
Okay.
All of our residents also have a vial of life. All their medical equipment, all their medical information is on the refrigerator, and also on that refrigerator is their DNR if they have it. So
Thank you.
that conversation has been had for those people who want to have it.
Thank you. So then the big and broad question is, if someone were interested in replicating this or bringing it to their area, how do you suggest they start?
Well, I think that I'm going to share my screen again and actually pull up our ALP coalition. Let me pull that again. So this actually right here is a loose map of New Jersey, where you can see at least those, we do have 14 providers in New Jersey, but 9 of those have agreed to be part of the coalition. And so we're located all over the state. And as Elizabeth had touched upon, when you are licensed as an ALP provider, you're licensed for one county and you can provide services in that county, plus one contiguous county, so a neighboring one. You can also apply, the providers can also apply to be licensed all over the state. But since there are existing providers in New Jersey and in different counties, it's spread all over, as you can see. I don't think there's any of us in the coalition who have said we don't want to expand and grow and don't want to spread the word about the beauty of ALPs. And so if you are interested, I'm happy to share this with you. You can maybe reach out to Dr. Kathy Rowe, and she can either forward your information, or you can reach out to us directly with the Bright Side Manor, with the Bright Side family, and we can help connect you loosely to maybe an ALP provider that's in your area.
Thank you.
I think the place to start is reading the regulations, which you can find, on the Department of Health website, and understanding that there are a number of challenges that come with starting an ALP. And we started the ALP again in Garfield Housing Authority, where there were already a lot of residents who we knew to be Medicaid eligible, and the need was great. I mean, the housing manager begged us to come in for years. But to our surprise, when we started there, and that was in 2019, there was way more resistance than we expected. And then as we were starting to build momentum, the pandemic hit. And so we've been challenged to build the census there. So just keep in mind that you're staffing with a registered nurse, with LPNs, with aides, with housekeeping staff, ideally with social work staff, and you're getting $57 a day reimbursement. So you better be prepared to subsidize the program deeply for the first few years. And we've been fortunate that we've had foundation support from Henry Mellon Taub Foundation, from the Brookdale Foundation, also from our county Division of Human Services. We've gotten grants. But it is, it's a wonderful program, and I completely believe in it and hope that it continues to grow. But simultaneously, we're really fighting hard for some increases in reimbursement and some modifications to the regs to make it a little bit easier for providers to operate.
Thank you. Thanks for the honesty on that response.
Oh, you're welcome.
So I think we've gone through all of the questions. I'm going to pull up our screen here. I appreciate all of you joining us today. A few of you asked for connections, and I will send you emails. Otherwise, you have questions after this, something you think of later, you can send it to me at crowe@njaaw.org or office@njaaw.org. And I've brought up the information on our conference, which is next week. Unfortunately, we are going virtual again, but in another year and a week, we hope to see you in person. We have a great lineup of presenters, starting with Louise Rush, who many of you know. And we're going to be talking about rebounding and rebuilding after COVID. We are talking about technology. We're talking about moving forward with age-friendly communities and age-friendly state. And I really hope that all of you can join us. And the information to register is on our website. Again, that's njaaw.org. And we hope to see you there. So thank you for joining us. Thank you very much to Margaret at Parker House for sponsoring this webinar series. We do plan to continue webinars in the future. We think it's an easy and quick way for people to connect and learn. And we will also be posting this recording on our website in the next few weeks. So thank you very much for joining us, and we hope to see you again next week. Have a great day.